So it's now my privilege to introduce to you the president of the Society for Personality Assessment, Dr. Radhika Krishnamurthy. Radhika is a professor of clinical psychology at the Florida Institute of Technology, and she's a licensed clinical psychologist in Florida. She's served as the program chair and director of training at Florida Tech's PsyD program and is now active in teaching a sequence of psychological assessment courses and supervising clinical training and research in personality assessment. Radhika is a former president of Section 9 of Division 12 of the American Psychological Association. That's the Assessment Psychology branch. She's a diplomat of the American Board of Assessment Psychology, a fellow of the American Psychology Association and of SPA, and is the past recipient of SPA's Beck Award. She serves as associate editor for the Journal of Personality Assessment and as a consulting editor for the journals Assessment and Psychological Assessment. Radhika has co-authored 2 books on the MMPI-A. She's written several book chapters and journal articles on psychological assessment and has presented widely on topics including the MMPI, the Rorschach, the PAI-A, the Adolescent Forum, research, therapeutic assessment, assessment training and competency development, and ethics and standards in psychological assessment. Please warmly welcome Radhika, the president of SPA.
Thank you, Ron, for that introduction, that lovely introduction. A warm welcome to you, my friends and colleagues. I'm honored to have this opportunity to share my thoughts with you about personality assessment. Before I formally begin my address, though, I have a few prefacing words. Many of you were here listening to Bob Arard's presidential addresses in the last 2 years and were witness to his extraordinary renditions of music and lyrics. Bob set the creative bar very high, and I must admit it made me very nervous thinking about this year. And perhaps you are expecting a talented performance of a similar sort from me today. I must advise you there will be no such thing from me, and I assure you, you will be grateful for that. My suggestion is that you nab Bob during a break between sessions and demand an encore. One of you let me know the time and the place. When I started composing this address, I thought over my various career experiences in the field of clinical psychology. There have been changing tides and indeed transformations. In my time, there has been the development and solidification of a managed care system, a move toward brief assessments and even briefer screening versions of those assessments, cutbacks and eliminations, as well as expanded applications of assessment. My mind went farther back to when I was an undergraduate psychology student in India at a time when the state psychiatric hospitals, with very few resources and hundreds of patients, fit every stereotype you might recall of mental hospitals in the old movies. I witnessed mental illness unmitigated by major tranquilizers. They weren't quite in use there in the late 70s and the early 80s. I have not forgotten those poignant images of personal chaos and suffering, nor the faces of desperate family members who traveled great distances at great expense for the occasional assurance that their loved one was being taken care of. I also recall vividly the hushed story of a woman who claimed she had been banished to the asylum by reason of being a disobedient wife. Was she delusional? Was she telling the harsh truth? At that time, I did not know of or have an assessment tool to determine the answer. I'm sure you know that such reflections puts one in a philosophical frame of mind, and I find myself returning to that place with increasing frequency. These thoughts also take me back to my roots, to the rich Hindu philosophy that I attempt to understand even more deeply as I get older, and that lead me to dwell on the concept of Dharma, which I will discuss today in the context of our work in personality assessment. Dharma is a Sanskrit word with multiple complex definitions and descriptions, and with different meanings in Hindu, Buddhist, and Jain philosophies, which carry personal, social, and metaphysical implications. It has no direct equivalent in the English language, so I will try my best to convey its connotations. At a basic level, Dharma is the moral law intertwined with spiritual discipline that serves as a guide for one's life. Essentially, it refers to a way of life and also the true nature of things. The root of the word dri means that which is held, and also manner of being. As a verb, dharma means to uphold, sustain, and uplift. In its interpretive applications, dharma refers variously to ethical behavior, fulfillment of duty or responsibility, service to the community, self-expression, and self-actualization. So it is a principle of being and a code of conduct, a virtue, an ideal of behavior and ethics. It is an internal decree and a regulatory principle. It is an intrinsic value to be adhered to for its own sake, with no external coercion. Dharma can be viewed as a lens through which human beings plan and implement their interactions with the world. Through the dharmic lens, one focuses on doing what is right and avoiding what is wrong. Dharma is fluid and dynamic and takes into account ever-changing time and place, with the wheel as symbol. It is basically phenomenological at its core. According to one of the great ancient texts of Hindu literature, the Bhagavata Purana, Dharma includes purity, known as Soch, and truthfulness, or Satya. In another slant, the eminent philosopher and poet Tulsidas of the 16th century defined the root of Dharma as compassion, or daya. The notion of Sanatana Dharma refers to a path of reason coupled with compassion. A specific form of Dharma, called Varna Dharma, is professional Dharma, which specifies our roles and responsibilities in our work. Dharma represents a universal umbrella of values across all these different meanings and descriptions. This leads me to speak about my conviction and the central point I wish to make today, that our professional work, just like other aspects of our lives, must essentially be value-laden. The notion of value-laden dharmic practice translates into 5 core themes for me. First, I bring attention to the importance of the quality of our work and an emphasis on quality over quantity if a choice is to be made. We have tremendous opportunities today to apply our expertise in assessment in diverse areas. If we think about it, assessment psychology has grown tremendously in the United States and worldwide since its formal origins in the 19th century, from the early developments in psychophysiological measurement and statistical concepts, the construction of the early mental tests, and the initial applications of testing in the late 19th and early 20th centuries to address practical matters in society. With regards to personality testing, the widespread application of testing during World Wars I and II to screen for psychopathology provided strong impetus for the growth of the specialty, with significant contributions along the way from trait theorists and psychometric test constructors, to mention a few. And it has withstood the anti-testing movement of the 1960s. New challenges arose with the strengthening of the managed mental care system in the 1980s with its cost containment priorities. And some feared the disappearance of assessment from the landscape of clinical psychology practice. Interestingly, as you all well know, assessment has stayed strong and in fact expanded tremendously, particularly with growth in the specialty areas of forensic psychology, neuropsychology, and clinical health psychology. And it has remained an integral part of assessing children and adolescents within school systems, clinical treatment settings, and juvenile correctional settings. At our SPA annual meetings, we have had several discussions in which our members have reported an upsurge in referrals for assessment in recent years, even as we have worried about the negative impact of managed healthcare systems on our career prospects and our incomes. Indeed, many of us have more opportunities for assessment work today than ever before, and more assessment referrals than we can reasonably handle. With the plethora of options for assessment work and the opportunity to establish profitable careers in the field, comes the risk of taking on too much, of doing assessment somewhat mechanically, of focusing on quantity over quality. I have seen practitioners in my community scramble to secure as many contracts as possible for doing, for example, Social Security disability assessments, and undertake an excessive amount of these evaluations in the fear that the referral stream will dry up. And I suspect that the caliber of assessment work is sacrificed in favor of volume. Now, I'm clearly speaking to the wrong audience here because I know that we in this room share a certain obsessiveness that serves as a safeguard against the erosion of quality. Nonetheless, I bring attention to the fact that we have important roles to play as practitioners and researchers whose products are seen by other professionals, as teachers and supervisors who are training the next generations of assessors, and as advocates of our field in demonstrating that good assessment done in the dharmic way are of great value. High-quality assessments are first and foremost accurate, with appropriate descriptions and explanations built on the foundations of correct scoring. In this regard, I'm reminded of Roger Green's recommendation to use computer scoring methods as a means to reduce the error associated with hand scoring, and Roger has increased his emphasis on this point ever since. Still, as noted by Roger in his 2005 article in The Exchange, even computer scoring can only produce accurate results when the test user puts due care into inputting item responses into the scoring program and double-checking the correctness of the data entry. Overall, adopting an attitude of mindfulness and commitment to accuracy facilitates attaining the level of quality we all seek in this regard. High-quality assessments are also individualized and person-centered rather than test score-centered, comprehensive and rich in description, and meaningful in conveying the implications of the findings. They have depth and reflect the use of critical thinking. High-quality assessment involves developing a conceptualization that is nuanced and incisive, that gets to the central core of the dynamics of personality and vividly depicts the adaptations made by the individual in his or her life journey. A high-quality assessment report may be contrasted with the type that is largely symptom-focused, impersonal, and template-driven. Indeed, we've probably all come across reports of that latter type that provide a catalog of medical and somatic symptoms, or that throw out words like depression and anxiety with the assumption that they are self-explanatory and therefore sufficient to merely mention. Worse still are the reports cranked out by an assessor that are generic, nearly identical, and therefore interchangeable. All that is needed is to change the client's name in the identifying information, and it fits. I've even seen reports where Susan on page 1 transformed to Andy on page 2, undoubtedly due to the use of a template in which only a few details are altered, and reflecting an overall carelessness that suggests a lack of investment in the work. The true nature of good assessment work is generative, revealing new facets of the individual's functioning that are meaningful, embedded in a relevant context, and well integrated toward a broader conceptualization. It provides us with the confidence that the findings reveal reliable and valid information that can be used constructively to achieve positive outcomes. The quality of our work is elevated when it is intrinsically valued and not simply pursued to guard our professional reputations or maintain our referral sources. This is the true dharmic way. So when I hear that there is no room for comprehensive assessments, or really for personality assessment at all, in the realm of primary care, for example, which I hear is the future of clinical psychology, that we have to be realistic in recognizing that brief, quick screenings are the wave of the future, or that there is no space in the academic curriculum for more than a survey course in assessment, I counter with the question, why not? Are we too busy for comprehensiveness and depth? Have we bought into the notion that faster is better? Does adaptation to the contemporary practice milieu require that we relinquish our ideals? I think not. Good assessment work is responsive to the needs of the client, for which it has to be essentially person-centered and humanistic in its approach. This is best exemplified in the collaborative and therapeutic assessment frameworks provided by Connie Fisher, Len Handler, and Steve Finn, and applied by so many of you. We are fortunate that with Connie and Len and Steve's immensely sensitive demonstrations and guidelines, we have progressed well beyond the days when the all-knowing and aloof assessor subjected the assessee to testing, reported the results in a detached way to third parties, and kept the assessed individual in the dark about his or her own functioning. As discussed by Connie Fisher in her book, The Collaborative Individualized Assessment, this approach goes beyond addressing a classification or diagnostic question and involves the assessor and client working together to develop productive understandings. It is a joint exploration with the benefit to the client as the major goal. Steve Finn, in his various works, has taught us how clients are more accepting of and able to benefit from test information if the findings are linked to their questions about themselves and their personal goals, and if the assessment process is approached with empathy and with compassion, which is basically the dharmic notion of daya. Len Handler has shown us how to assess children with sensitivity and understanding by meeting them at their developmental level through a storytelling approach that is ultimately change-producing. The dharmic principle of self-actualization, of personal growth and transformation, is furthered in these approaches. I think we succeed in being responsive to the client's needs when we approach the assessment with open-mindedness, which includes being flexible, unprejudiced, and respectful, or more familiar to us in the domain of personality, with openness to experience, described by McCrae and Costa as involving intellectual curiosity, behavioral flexibility, and non-dogmatic attitudes and values. However, responsiveness to the client's goals does not mean we lose sight of the referral question or the interests of other parties involved in the assessment. Our assessment work is most effective when our facilitative reach is broad, providing understanding and direction to the psychotherapist, psychiatrist, school teacher, parent, spouse, or correctional officer who has an interest in the findings and outcomes and who can do something with it. Adopting a mindset of openness enables us to bypass false dichotomies, such as we either serve the person being assessed or the referral source, and helps us to keep an eye on the overarching goal of the assessment to be maximally beneficial and impactful. It allows us to go outside the box and question prescribed or assumed limits. So, for example, when we might be told that we can't do therapeutic assessment in a forensic evaluation context, we might ask, why not? Is the attainment of personal understanding and change at odds with the goals of the court or the prison? Does there only have to be a single goal or a single client? During this conference, my students, Lauren King, Stacy Pollitt, Laura McCord, and Corinne Russell, will be presenting a series of cases in which they demonstrate therapeutic assessment done with clients of different ages, sexes, ethnicities, and in a variety of settings, including a jail. Their assessment work was directed toward being responsive to the interests of a therapist, a parent, and a mental health unit director, in addition to the individual being assessed. This project enabled us to sense that the sky is the limit in what we can achieve with responsive therapeutic assessment. A third theme here is a commitment to ongoing learning. Our assessment work is refined when we are not content with what we know and are eager to immerse ourselves in further learning, which is certainly a driving motivation for us to have come together here at this meeting. As teachers, we teach more effectively when we continue to learn. As practitioners, we do better work when we keep abreast of new and revised tests and are informed of their psychometric adequacy, and when we rely on the published literature to refine our use of the assessment instruments. As researchers, our contributions are sound when we incorporate advances in statistical techniques and conceptual developments. We are fortunate to have active researchers and test developers among us who provide such advancements in measurement. These are the ways in which we achieve, sustain, and elaborate our assessment proficiency. At this meeting, I personally look forward to learning from you about the latest research and applications with the CS and the RPAS, the MMPI, PAI, and MCMI, the Adult Attachment Projective Picture System, and the Diagnostic Drawing Series, and so many others. I hope to deepen my understanding of DSM-5 personality disorders, assessment of trauma, interpersonal dynamics, and cultural contexts, to name a few. Of course, we never get our fill in a single meeting, so we return for more each year. We also have the Journal of Personality Assessment with Greg Meyer at the helm, keeping us in a learning mode throughout the year. Overall, we have a cornucopia of resources for learning and no excuse for being complacent. In my opinion, a true commitment to ongoing learning involves three essential components. First, it is not a passive intake of information, but involves active assimilation and accommodation in Piaget's sense of those terms. So arming ourselves with handouts, books, and journal articles will not suffice. Rather, true learning involves reflecting on what we have learned, incorporating it meaningfully into our work, and adapting our practices accordingly. Second, committed learning involves an honest appraisal and acknowledgement of gaps in our knowledge and a non-defensive desire to correct any deficiencies. Third, true learning is self-directed and inherently valued instead of imposed. All of us have continuing education requirements for maintaining our licenses in our respective states, and we succeed in reaching our annual quotas of CE credits. But I'm sure you agree that the most fulfilling learning comes from what we seek of our own initiative. A fourth theme I'm going to talk about is ethics and standards. The dharmic road is essentially an ethical one, And the principle of Dharma addresses the self-discipline needed to be ethical in work and life. Assessment psychologists have several excellent resources available to guide us in upholding the standards of practice and following an ethical course. These include the standards for educational and psychological testing, APA's Ethical Principles of Psychologists and Code of Conduct, of which Standard 9 deals with assessment, and our own SPA's Standards for Education and Training in Psychological Assessment, which was published in JPA in 2006. Furthermore, we have access to recent competency development guides, such as the competency benchmarks that were published in 2009, put together by a work group coordinated by APA, and the developmental achievement levels, also published in 2009, which was put together and provided by the National Council of Schools and Programs in Professional Psychology. I believe competency development and proficiency attainment are inextricably tied to the ethics and standards of our work. Incidentally, Virginia Brabender has put together an ethics symposium for this meeting titled Making the Right Call, in which she, Jed Yalof, Bob Berard, and I will be presenting, and I will speak more on this issue at that time. Following an ethical course requires a constant awareness of the power we hold in making decisions and determining outcomes for the people we assess. In his 1993 article titled Tests, Small Samples, Large Consequences, Grant Dahlstrom alerted us to the fallibility of human judgments and reminded us that our decisions affect people's lives. He said, and I quote, "Information based on poorly constructed and inadequately standardized tests or poorly executed administrations of even our best instruments can serve to mislead and distort clinical judgment. The consequences are too large to neglect," end quote. In preparing for a recent invited lecture on assessment ethics and standards, I examined the types of assessment-related ethical violations reported by various state licensing boards and was astonished at what I found. In one case, the assessor was reprimanded for conducting a forensic evaluation on one of his psychotherapy patients using A, an outdated test instrument, and B, for incorrectly scoring another test. So there were two things that happened in the same evaluation. In another case, the psychologist was admonished for making custody recommendations without doing complete evaluations of all the concerned parties. I'd like to believe that these professionals did not willfully set out to be unethical, but were more likely negligent. What this means for us is that we cannot be smugly secure that we are different from them and that this will not happen to us. The potential for oversight is there for each of us, and we have to be vigilant and self-inspecting to stay on an ethical course. Over the years, I've done a few consultations in child custody disputes in which I was hired to re-examine assessment data and reports deemed to be prejudicial to a particular client, so the client's attorney would contact me. A particular case came to mind in which I was engaged by the attorney of the wife in the custody seeking couple, and the wife was the mother of 2 young children. And I'll limit my example today to the MMPI-2 results reported by the assessor. Basically, the assessor had concluded, based on the MMPI-2 profiles, that this woman had a psychotic condition with, quote, paranoid delusions, paranoid defenses, and fairly gross reality distortions. When I examined the profiles, I found average to low scores on several scales and indices of disturbed thinking, including Scale 8, subscales SC3, SC5, and SC6, all subclinical, as well as the bizarre mentation content scale. Using the client's item responses, I scored the Psi-5 scales because they had not been scored, and I found it yielded a T-score of 55 on the psychoticism dimension. for this woman. Subclinical, within 1 standard deviation from the mean. Was this incompetence on the part of the assessor? My sense is that he looked simply at some statements in a computerized interpretive output and amplified them without carefully examining the score patterns. Furthermore, I found that although this woman's scale 6 T-score was 59, whereas her husband's scale 6 T-score was 61, her report at 59 contained the description that she was paranoid, and his, in fact, did not. As I give this example, my mind conjures up the face of that woman in a mental hospital in India who declared she was confined for being recalcitrant. Flashing back to the present, was this a gender bias of this examiner? Are we as assessors sometimes complicit in viewing women as maladjusted when they are outspoken? But then I have to stop and examine my own slant in viewing these issues through a gender lens. In any case, the point remains that as ethical assessors, we have to be as free of bias and prejudgment as we can and seek regular consultation because we cannot see our own blind spots. Our responsibilities as assessors are weighty. People depend on us to know what we're doing and to deliver accurate findings. In teaching graduate students, I often ask them to imagine that their child is being assessed for a learning disability, or their loved one is being evaluated for psychosis, and ask them to envision the devastating impact of a misdiagnosis, the hurt caused by a carelessly tossed remark in a test report about their poor parenting skills, or the confusion they might experience when they don't receive thoughtful feedback. I hope the message hit home for my students. Being ethical means that we are conscientious and sensitive in our work, respectful of people's dignity, appreciative of diversity, and cause no harm. A final consideration in this dharmic discourse is that of service, which I think of as twofold, attitudinal and behavioral. Our assessment work is most worthy when we adopt a truly service-minded mindset in what we do. If we begin our tasks with the question, how can I help? The focus of our helpful intent can be wide-ranging, from mitigating a client's despair to facilitating placement for appropriate services, from aiding student learners in their quest to comprehend concepts and develop skills, to answering necessary research questions with empirical investigations. In terms of assessment practice, I am impressed with how many people I know who do some assessments gratis or at a subsidized rate for clients who have financial constraints. Incidentally, I'm intrigued by a session in this meeting's program titled The Humanitarian Side of Personality Assessment, Pro Bono Immigration Evaluations, to be presented by Giselle Haas and colleagues with Barton Evan as discussant. In terms of research and teaching, I'm aware of the countless non-billable hours put in by so many of my colleagues who are researchers and academic faculty simply because they value doing it. In this regard, I have to give special mention to Joni Mehura, who has put innumerable hours, heart and soul, into her review of validity research on the Rorschach Comprehensive System toward producing what I believe is one of the finest papers in the recent Rorschach literature. Behaviorally, there are numerous outlets for service that extend to service to the profession, for example, by participating in professional boards and committees and engaging in advocacy, and community service, including during times of crisis. Such service is not without returns because we obtain immeasurable gains in personal gratification from it. In conclusion, I assert that a value-laden approach to assessment work is to be cherished. It is neither naive in concept nor impractical to follow. Adhering to our ideals need not be at odds with being pragmatic in our contemporary professional context. Just as a good assessor reconciles diverse and seemingly contradictory findings from different data points, so can she or he harmonize the value-laden assessment method with the demands of the workplace. I know you resonate with the points I've made and share an interest in this way of Dharma I've described because I've seen it in your assessment work. I end my address with this Sanskrit quote, Dharmo rakshati rakshitaha, meaning protected Dharma protects. Together, we can uphold the highest standards of our specialty, demonstrate the best assessment practices, and pass on the values and attitudes of our professional work, along with the knowledge and skills, to future generations of assessment psychologists. Thank you, and have a wonderful time at this conference.